welcome to MedTech World Dubai 2025. I'm here with Adonica. She's the founder of Wingwomen. Thank you very much for being with us.
Thank you for having me today.
So let's talk about Nina, your product.
Yes. So in 2023, I made an attempt to patent the vaginal speculum. Not sure if that's going to come through or not yet, but in 2024, due to a lack of funding, the project stopped. A few months ago, in November of 2024, I attended MedTech World in Malta, and I met some amazing individuals there who wanted to hear all about my almost failed patent attempt on the vaginal speculum. And so, after reviewing the patent application, reviewing all of the feedback that I had been given since kind of letting the project go, they said, "Oh, well, perhaps you should try over." And so, with that confidence of having people believe in what I was trying to build, I went back to the drawing table and reimagined Nina not just as a AI-powered vaginal speculum, but also as a paired device that is a VR headset version of the colposcope. So, the delay, although very heartbreaking at the time, turned out to be a significant advantage later on.
So that's the way that you're gonna pitch us today in the stage, correct? You're gonna be in the stage in around 10 minutes. So what are the strategy to win this pitch this time?
Honestly, I think it's authenticity. So many times as founders and as entrepreneurs, we come in with speaking points and bullet points, and we say we were doing this and we, went to market and we always got it right. But I think my story is a little different. I tried really hard, tried to get the money. It fell through, and I unfortunately gave up and walked away. And either by happenstance or synchronicity or just people coming together and really help rallying me around my work, I found my way back in and way better than it would have been prior to. So my strategy is to just explain my story and my path and just be authentic in that.
So where Nina started Wing Woman?
So Nina did not start until the fall, the reimagined version of it. And it was really a combination of things. It was feedback from different patient advocates. It was feedback from different engineers, different computer science professionals, doctors. I myself am a doula and a midwives apprentice, so midwife, and taking all of those things into account after essentially giving up on the device in the past. And so over the last several months has been the reimagination of all of those pieces of feedback. And so Nina is something that, again, is more recently ideated, but was born really years ago through sheer failure and a lot of frustration, just to be honest.
So you had the experience in Malta, a different ecosystem. Today we are in the GCC.
Yes.
Why exploring this region?
Well, number one, I loved the experience that I had in Malta. Everybody was very welcoming. I'm all the way here from Silicon Valley in the United States. And so what's been interesting, particularly on the other side of the pandemic, it's been harder to find pockets of people that are just truly driven by innovation. And so both being in Malta and then even being here in Dubai, everyone is so open-minded and willing to lean into your innovation and your idea to challenge you and push back on some things so that you get better as an entrepreneur, of course. But being here has been wonderful because, again, it's been something where people are looking to see what I'm actually trying to do and help me hone it. Whereas I've been in other locations around the world and they're quick to say, "Oh, that'll never happen." I think what's been really good about this ecosystem is that people here are very much like, "Oh, that can happen. In fact, let me tell you about my friend." So it's been really nice.
Indeed. So good luck. You're gonna pitch in a couple of minutes. So the best of the luck.
Thank you.
Thank you and see you around.